Hi. Today is August 2nd, 2025. So I'm 5 years out from Guillain-Barré diagnosis. A year ago, I sat down and made a video and just kind of talked as long as I could continuously about it got to, I think, the first 12 days. So I was just coming out of my coma. And I'm going to keep talking about that, and it's just going to evolve into something that is going to encompass every experience that I have gone through, and try to share as much as I can for people that on all sides, really. As a patient, you know, hearing what I've gone through, knowing the experiences that I've had, how I've dealt with it, the resources that I was aware of, maybe resources I'm aware of now that, you know, I wasn't at the time. But anyway, you know, showing some of the things that I've done that might help you to overcome an obstacle that you're facing. The same might be true for people that are not in a terrible situation. I mean, there's all kinds of situations people get into that it's just like thinking outside the box and applying something that might be difficult or, you know, just might not be the standard way of thinking. But just there's a lot of obstacles that have come up in the last 5 years that have required, you know, challenging creative solutions. But I'm here. Also for the caregiver side, like maybe to hear as much as I can talk about from a patient side, and also coming from a patient care background prior to getting sick, there's a lot of information that I might be able to relay that might be communicated differently because I'm a patient with the background. Anyway, just again, gonna try to share as much as I possibly can and continue to make videos more frequently than over a year. The video that I made a year ago, it took 4 years to get to the point that I could make that video. The amount of energy it took to process all the information that I had gone through prior to communicating it, it just simply needed to be filtered. And the same is going to be true going forward. So this year that it took to get to this video, like I said, the next few videos aren't going to be quite that long time frame between, but there's a lot of perspective that I had to get on some things before I was able to talk about it. So here we are. Welcome. My name is Kyle. Most of you would know that from the previous video that ended up being 11 videos chopped up, but it was one video for me to make. So from the moment that the last video ended, I was talking about coming out of the coma for the first time that I was aware of. So when I when I found myself in the ICU recovery, the ICU, what I saw and where I was and what I experienced were all different. So when I talked to the nurse and said CPAP, as far as I know, that happened. But the only way that could have happened is if the nurse literally could read my lips, which she couldn't. But if I could have articulated, you know, a breath sound out enough, I'm 99% sure in my, memory that this situation actually occurred, and that's the difference from everything that took place prior. So having that connection where the nurse told me I was on the vent and that I was in the hospital and everything was taken care of was completely different experience-wise than everything that had taken place prior to that. But what I wasn't aware of at the time was I was still heavily sedated. And when I talked to the nurse, what I saw was a nursing station and ICU that doesn't exist. Basically, I woke up on a bed that was on a pole. So if you can imagine ceiling to floor, a pole, and in the middle of one side of the bed is welded to the pole in the middle, and that is like a half moon, and that was the bed that I thought I was on when I had that conversation with the nurse. Also, the nursing station did not resemble the nursing station that I was actually in. The whole space was actually different. So the communication, though, that I had with her was, as far as I can tell, factual. But it's also interesting to note that she is the first person that I recognized in real life coming out of everything, from that prior video and all of that experience. Now, I'm still heavily sedated at this point. So I am trying to tell the nurse that I need the CPAP. And she tells me, Kyle, you're in the ICU. We have everything that you need. You need to rest. You need to sleep. And as soon as she told me that I was on the vent, I felt so much angst and anxiety and stress just dissolve. And I did feel like I could sleep. I remember actually going to sleep. But again, I'm in and out of every conscious moment that I experienced over the last 12 days. And again, that was when she told me I'd been unconscious for 12 days. So I was lucid enough at the moment to recognize that she had told me that I had been sedated for 12 days, which happened to be true. So that's kind of where I based the reality in that situation. But that moment was short-lived. As soon as she told me that, I remember relaxing and basically going back to sleep. Or what I thought was back to sleep. But what happened is I tried to go back to sleep, and all of a sudden I felt myself pulled into not another nightmare, but just another place again. I was no longer in the ICU. I remember looking up at the ceiling in the I felt like I was in a storage room. You have those wire racks that line walls in a storage space, and I felt like I was in a room like that by myself, attached to the ICU, but kind of not set up right, except right where I was. Like, it was 3 times bigger than it needed to be for me to be in it. And that extra space, and even the space in front and behind me, was all storage. But I was, I don't know, I was in this room and I'm looking out over the it was the place that I was in ended up being 3 floors. So it was not real, but I was sucked back into a recovery space that for some reason doubled as a gym, fitness center, had a steam room and a pool and a waterfall that cascaded into the pool. And for some reason there was on the far wall outside my room, past the nursing station, what should have been other patient rooms was a hydraulic parking lot for the doctors. So I would see people like coming in and like walking right past me, stretching 18 feet away from me. I was like right in front of the door to this elevator that would take people up and down. And I would see people come out of the parking garage that was in the ICU right through the nursing station. So it's my room, the space between my room and the nursing station, and then the space that should have been between nursing station and rooms, but it was between nursing stations and a glass wall with Porsche and BMW and Ferrari, and there was an old muscle car. I think it was a Camaro or something. These vehicles were parked like in this glass room that would rise up from the basement. So the doctors would pull in and then it would rise up. They'd exit their vehicles in the ICU space and then, push the doors open and come out, and they were in the ICU. And at the same time, people were coming into this space to work out. Like, from where I was, I could see the elevator in front of me, and then I could see like a second floor where there were a lot of weights and things, and then a third floor that had steam room and sauna and stuff like that. It was really weird. And I remember being sometimes when I would wake up, I was on a couch in the ICU gym place with this cascading 2-story waterfall into the pool that was in the middle of the first floor. I remember periodically, I'd wake up on the couch and I felt like my head was on the armrest of, let's say, oversized leather couch with really wide, soft leather arms. And that was, my body was laid out across the cushions and my head was on the armrest. And it was just totally bizarre that I was experiencing that. Sometimes, again, I was on that little half moon bed thing. I remember being told that I hadn't pooped and that they needed to get a sample. And I remember feeling like I was on this half circle bed that was on a pole, which felt extremely unsafe at the time anyway. Like, it was inappropriate and shouldn't have been that way. Like, all of these things were red flags. Like, I could not rationalize what was happening. But I knew at this point that I was okay. Like, I had already had the experience with the nurse where she told me that I was okay. And I recognized her, even though I don't remember ever seeing her prior to that. She is one of the nurses that I knew once I was coherent. Like, once I was lucid again, after all of this. Like, she was one of my regular nurses. Like, I recognized her. Sometimes I would wake up and I wasn't experiencing strange things that I couldn't explain when I was asleep. Now I was experiencing these things in my environment that I was recognizing daily, or what I thought was daily, when I was waking up. So sometimes I would lay there in bed and I would see, it looked like while I was looking up at the ceiling, I was looking down on a saloon, Western, early 1800s or prior style dirt floor or wood floor saloon, and sometimes it was 2 people playing cards and I was looking down over the table from the top. Sometimes it was 3 people, sometimes it was 4, sometimes there was a group of people dancing in there. Sometimes there would be a fight or something that would break out. I remember one time being really worried about the people up there because I couldn't figure out how I was looking down on them when I was looking up. But I remember they were playing cards and things got heated, and there were 2 guys and a girl, and the girl was in one of those old time dresses, and I remember one of them flipped over the table, and I think right at that moment, like, the table got flipped and the nurse was like there. All of a sudden, there's the nurse. I'm like, oh. So that was gone. The nurse, this is kind of when I realized the drugging that I'm experiencing is from the nurse. This is kind of that first time that makes sense, because I'm experiencing moments where there's a brief overlap where I am looking up at these people playing cards or dancing or whatever in this saloon, and the next moment the nurse is at my bedside telling me, Kyle, it's time for basically re-up. It's my timed medication delivery, or for me, receipt. So I did not know the medications that I was receiving. When I finally became lucid enough, I don't know when that was. I know that I was sedated, unconscious, and only awake in a twilight sleep long enough to communicate a need for the first 12 days. After that, once I came out of the medically induced coma, I began a wean down or wean off process of all of the medications that I had been receiving to be sedated, so to be unconscious. So, not knowing anything that I know now, then, I remember being intentional. At some point, I became intentional that every single time I woke up or saw a nurse or was talking to a nurse, I was going to ask, what medications am I receiving? Now, I was not aware, because I wasn't lucid enough to know this, I couldn't speak. So a lot of this, me talking to the nurse, was not actually taking place in that sense. I was very, very, drugged. Yeah, I had a lot of medications in my system that I was unaware of. So there came the point where being lucid was more common than hallucinating. And I remember finally waking up one morning. I remember asking the nurse for what medications I was taking, and I don't remember how many times I had to ask, because they knew that I was agitated. They knew that I was having a hard time. They were trying to be helpful, so I think they were adding medications to help. But what it ended up doing was just overwhelming my system. So I had a lot of things going on that I wasn't aware of, and it all kind of felt like I was, out of control of my situation and environment, which technically I was, but I wasn't aware of the fact that I was in that situation. So mentally, I was a lot more structurally sound than I physically was in reality. I remember asking to be told what medications I was on, because I wanted, and this is where I became deliberate, I wanted to stop taking the medication that was making me hallucinate. That was when I realized that it was the nurse that was delivering the hallucination. And after everything that I had been through, finally realizing that and being able to put those points together, and it brought so much relief to know that all of that was in my mind. Now, sorry, my battery died and kind of snuck up on me last second there. So realizing that the events that had all taken place were taking place in my mind, and I could associate now the fact that I was receiving medications that was causing the hallucination. It brought control. So now I was completely okay with the fluctuations in being lucid or hallucinating. I was now coherent and aware that I was hallucinating in a controlled environment. So I think that was really important. So for a period of time, I remember trying to, there was a specific nurse that I think, came in the mornings when the doctors were doing their rounds, and she was the nurse that updated the chart. So one of the things that I really wanted to get done was stop taking the medication that was causing the hallucinations. I made a point to communicate that need to the nurse, but for some reason, maybe because my brain was mush after everything that was taking place, I remember being told on several occasions what medications I was taking, and I feel like I never actually got the entire list. Maybe because I felt like as soon as I heard fentanyl, my lizard brain just like kicked on, going, oh, that's, you don't want that. Like, stop taking that. Because in my brain I'm associating it with bad because on the street it's bad, and it's lacing things, and it's a source of people being drugged against their will. So my brain was associating that with the experience that I had, not realizing that the fentanyl was not causing the hallucinations. So I told that nurse that was updating my chart that I wanted her to put that I was allergic to fentanyl in the chart so that I would never have to go through this again. Now, I thought that was a really good idea at the time. It wasn't for a few more days at least before I was really alert enough to know. It clicked. I was like sitting there one day going, fentanyl didn't do this. I need to find out what did. So again, I asked the nurse, hey, can you run through all of the medications that I was on, or was on? And that's when I found out that I was on ketamine. And when I found out that I was on ketamine, everything suddenly made sense. And I was like, oh my God. I felt overwhelmed with the knowledge that I had been on these drugs, because I was also told at the same time by numerous nurses, several, I think the morning nurse that was updating the chart, but also my attending nurses would tell me, I was on a very, very large dose of medications during my sedation, an abnormally large amount. And I guess, I'm finding this out obviously after the fact, when they went to intubate me, everything went fine. Once they tried to hook me up to the vent, apparently what's supposed to happen is they give you medication and you relax and the vent does its job. For me, they gave me medication and the vent, I guess I was fighting it. So they gave me more medication and I kept fighting the vent. So they gave me more medication, and I guess this happened, I was maxed on the medications that I was allowed to receive. So I was maxed on 6 different medications for 12 days. And when I say max, I mean like the limits of what you're really supposed to be receiving, and the high end of any one of these medications, let alone the 6 that I was on. I know one was propofol. I know one was ketamine. I know one was fentanyl. I believe one was Versed. I have to look, and I'll get back to the other 2. I don't remember, and I have to confirm the Versed too. I can't confirm off the top of my head that it was Versed, but I know that I was on like Seroquel also, so that might have been one of the 6. Yeah, so the Seroquel was supposed to help me relax and sleep. And then there's another one that I can't think of off the top of my head, but I know Versed could be, I'm thinking, because it's yeah, I'll have to look at what the other one was. But I think there were 6 total. And again, I was at the limits of what was allowed to be administered. And that was the point, basically, that I stopped fighting the vent. I think. I don't know if I actually ever stopped fighting the vent. I really need to follow up with some of the nurses. And that might be something I need to look into in the future, is actually sit down and talk to some people that took care of me, if any of them even remember me being there. But that was one of the things that I intended to do a long time ago. But again, we're 5 years down the road from that, and it took this long to make this much progress, both mentally and physically, to get to the point where not only can I make these videos, but it would be realistic to even revisit those experiences from the past. But anyway, the ketamine, once I found out that I had been on that, it like everything just made sense. Everything just went click into place. And then even down the road later, to find out that I was on the Seroquel, I think the medication that I was on, whether it was Seroquel itself or something else similar, was one of those that was supposed to give you, like, a lot of people were reporting nightmares and things when taking it. So again, I did not choose this medication, nor had I ever taken it in my life. This was something that was given to help. So all of these medications ended up being administered over a long period of time, well, 12 days, short term, but long term, in a high enough dose that, I was worried about what kind of withdrawals my body was going to go through. I'll say now, I never felt like I went through any withdrawals. So, to be on the amount of medication that the nurses are telling me that I was on, and my chart, I think I have, I don't know why I'm looking over there, it's in the other room. I have a binder with all that information in it. Reflects that as well. But I was really worried that I was going to have a lot of long-term effects, or that something was going to happen due to the amount of medication, the ketamine, the fentanyl, or something else that I was on, Versed even. But at the time, I don't think they knew what else to do. They needed to get me calm enough, and when I say calm, I mean relaxed enough to let the vent do its job. But the weird thing for me is I was diagnosed with Guillain-Barré, and the reason that I was intubated was I was feeling like I was losing the ability to breathe independently. So how was I fighting over the vent? So, you know, one of these things that I need to look into and find out a little bit more about. So one of the struggles that I had, I think that I was told when I was sedated, when I was intubated, that I was going to be unconscious for about 3 days, could be longer. Ended up being 12. Now, again, I was unaware of the extension until after the fact, and I found out the extension was due to ventilator-assisted pneumonia. So I maybe because I was fighting the vent, so hard, it caused my body to fight this infection. I got pneumonia, which is obviously something that was introduced to the tissue in the lung, and that could have been in the intubation process. But I did not know this, obviously, until I was told, so if I woke up on day 12, this might have been day 14, maybe 15. Again, the time frame I was getting weaned off of ketamine, fentanyl, so I was not really aware of time per se. My ups and downs kind of went with my medication delivery. So I was it's weird to talk about when you're told about it and haven't truly experienced it, but basically I almost died while I was sedated, and I guess it happened in the middle of the night one night. My SpO2, so my oxygen saturation, started to decline. 92 to 100% is what they want you at. 92 is pretty low. Down in the 80s, they're going to be working to get you back up to the 90s. I guess over a period of a few hours, my O2 saturation dropped from 97, 98 steadily, and bottomed out around the low 70s. And there was no indication that it was going to stop. So I ended up getting TPA. This happened, and I'm, telling you about it after the fact, after I found out about it after the fact. I guess in one of those middle days, maybe 4 or 5, I developed a clot, probably, they think, in a lung, and they could not, despite all other interventions, get my oxygen saturation above, to go back up. It just kept going down. So typical procedure is to package a patient and transport to CAT scan. I believe they're going to go to CAT scan, and they're going to run a scan to confirm the belief of a clot before the doctor is going to determine if TPA is going to work. They have to confirm a clot, what type it is, stuff like that. But what ended up happening in my case was at the time that my oxygen saturation continued to decline, I was deemed too fragile to move. So I was in such bad shape that I've moved a lot of patients from ICU, from all over the place. And it's rare that you have somebody that they don't want to move. I mean, usually they don't want to move anybody if they don't have to. But as far as going for a procedure, it's kind of a routine thing. Like, you call the team knows what they're doing, they, help the nurses out, they take the equipment, everything travels. It's not ideal, but they make it work. For that not to happen is probably happens more than I'm aware. But I must have been in really bad shape. And then to make the decision to give me the clot buster blindly. So they had no idea if it was a clot, if, where the clot was, if this would work. It could have been that I was bleeding out. I might not have had a clot. I might have been bleeding out. Just saying, this could have, turned my insides into just a wet mess. But, that was a risk that had to be taken. And luckily they did. I was given the TPA according to the nurses and the chart, and my oxygen saturation started to go right back up. I did find out, in those first couple of days when I'm still kind of going in and out of consciousness as far as being lucid, that I did have a blood clot in my left leg. But again, this was super early, and I found out a few days later that I'd actually had 3 PICC lines put in during the time that I was sedated because they kept collapsing. So, yeah. Man. I remember one of the last, this was whatever day was the last day that I got ketamine and hallucinated. This was that day. I remember a nurse that I thought I was in the storage room with the wire racks with all the storage supplies, and a nurse came in that I was told was a student nurse, or was a brand new nurse. I think she was a brand new nurse, had just graduated, and her name was, whatever, we'll say Jessica. And when I saw her, I swear to you to this day that she was a nurse that I worked with at a prior job, and when I worked with her at the prior job, I thought she was incompetent. She wasn't a nurse at the job that I worked with her at. I think she was in nursing school, which is why this person looked like, or, I thought was this other person. But what ended up happening is I have to have been still hallucinating. I thought she was someone else. Mind you, I can't speak. I mean, I'm mute. I can't move. I'm completely paralyzed right now. She was going to change my Foley catheter. And that is the urine tube that goes into you, man or woman. And the process I've been a part of a number of times. It's not pleasant, but what I've heard a lot of patients say is when you try to insert the Foley, especially if you've never had it done before or if you're new to it, maybe somebody that's seasoned or does it themselves or has done it for a period of time, has a different experience at that point, but I think all beginning experiences are pretty much the same. I had heard that there's a especially for men, and maybe it's our pain tolerance, there's an immense buildup of pressure, and it creates a massive amount of discomfort. Now, this is what I've heard. So I'm hearing that they want to change my Foley. And I'm thinking, this is so unnecessary. Why do you need to change my Foley? Why don't you just get a urinal and let me pee in the urinal? I can pee, I can void. Now, I don't know if I could void or not, to be honest, at that time. But I was confident that I could, to the point that I was pissed that they were letting this incompetent woman, girl, person, doesn't matter what she is or who she is, just the fact that, at that time I felt that she was somebody incompetent, was going to be doing something so grossly personal, so grossly invasive, and so potentially uncomfortable, and that this person that I thought was incompetent was the one that was going to get to do it. And I'm like, I don't need this. I can pee just fine into a bottle. Just get a urinal for me. Let me pee into a bottle. But I was adamant that she was not going to do this, and I was pissed. And oh my God, it's as far as I can remember. It was the one and only time I was ever conscious for a Foley catheter, and my experience was similar to some that I've heard. Not nearly as bad as I've heard some, but it is pressure. And it is uncomfortable. I wouldn't say it's painful, but I mean, if you associate discomfort with pain, then you're going to be squirming quite a bit. But if you can understand that it's pressure, because your bladder has a seal that prevents urine from leaking, that the tube has to basically push its way through, because it's naturally closed. Otherwise, we'd all just be walking around tinkling everywhere. But it was thankfully I only remember going through that once, but it was uncomfortable, and there was pressure for sure. Not something I ever want to go through again, and not something that I want to get comfortable getting used to. So that was, I must have been hallucinating, as you've probably figured out, but it was very real at the time, and it was very invasive. I was extremely pissed that it was somebody that I thought I knew that I had bad experiences with in the past that was now perpetrating this to me here in this moment. And that just added to all of the other anxieties and frustrations and everything that I had overall, even though, knowing that I was in reality now and not in somewhere that I couldn't associate with anything. Even though things were better, there was still that feeling, of being out of control and whatnot. So this was just one more thing on top of that. I'm like, this person of all people, in this situation, it just seemed ridiculous. Now, right after that happened, everything kind of became more steady in terms of, like, I wasn't hallucinating, or at least the hallucinations weren't as severe. I don't remember exactly how many days went by, to be honest, between the time I was sedated till the time I saw my partner for the first time. Everything that I had experienced was in total isolation, and everybody that was going through anything at that time was in pretty much complete isolation. Even if you came into the ER for something, you were isolated. So from the moment you walked in to the moment you left hospitals at that time, people were pretty isolated. But it was difficult for sure. I remember going to sleep when I was sedated, when I was intubated, and I was in one room, and my head was at a specific end of that room, and to my left was the glass sliding door. Outside of that was the nursing station, and to my right was a solid wall. When I woke up, in terms of, became fully lucid, and, morning, started going through actual days. At that time, I had been put into a different room, and this room had a window. It did actually have a window, and the window was on my left. So the glass door was to the right, with the nursing station outside was on my right, and there was a TV at the foot of the bed in front of me on that wall, and to my left was a window that in my room was probably, for a 5-foot person, was probably at shoulder height. But if you were outside that window, I'm pretty sure that window was at ground height. So I remember, as I am coming to, and being more coherent and aware of everything day to day, I remember seeing my family and my partner outside that window. And one thing I remember seeing when I was actually like waking up like a real person and, having actual time, I remember the nurses would come in and position my head, and they would, help me to turn it, because I'm basically like this all the time, and everything is just getting stiff from inactivity and contracted. And, in addition to turning me and whatnot, I did get, we'll talk about that. I had to get turned on my side, obviously, like every 2 hours. But I remember they would come in and they would turn my head towards the window, and my partner's sister, who I worked with in the ER, I remember seeing her outside the window, crouched down, just, like on a break or something from work. But so she'd be in scrubs and whatnot, and the sun, I feel like it was sunset, so she would have just, been first break on the night shift, and I would have my head turned, and she would be crouched right there, kind of between the plants and the window. And I remember this happening quite a few times. And within a couple days, I guess, of coming out of the medically induced coma and being weaned off the medications, I got my phone. That was weird, to realize how much time's gone by. Like, I had like 200 emails or something. And I know for people, that do emails for a living, that's not a lot, but I don't. I get like, I feel like I get like maybe an email or two a day. So, and that even pisses me off, to all of a sudden see I've got like 150 or 200 emails. I'm like, oh my God, who's trying to reach me and why? So I can't see my partner yet, but I get to talk to her on the phone for the first time, and it was so good I couldn't talk, but the nurse, would, come in at pretty much change of shift. So she would get on and she'd come in my room and she'd get me all situated. And then my phone had been put on a clip arm. So it's like a 2 or 3 foot flexible metal arm that's wrapped in, it could be wrapped in plastic, rubber, leather, but it has a phone clip at one end and a clip that attaches to a desk or a table or the bed in the room that I was in. And my phone would be on this arm in front of me, and I could be on FaceTime with my partner. So that was really amazing. Again, I wasn't able to speak, but the nurse would come in, she would get that set up, and my partner would call, and the nurse would answer it, and I would be sitting there, and I looked horrible, and my partner would be looking at me, and I can't imagine what it looked like to her, looking at me. I know that she had been to the window, and so she got to see me before I ever. She was able to see me while I was unconscious. She saw me way before I even had a choice in the matter. So she had come to the window quite a bit. My family had also come to the window quite a bit. My partner's sister had come to the window quite a bit. Sorry about that, the camera died again. So, I was talking about my window, and how I got to use FaceTime to see my partner, and I don't remember exactly what day it was, but whatever day I was fully alert for the first time, I remember all of a sudden my room that I was in was very real compared to all of the places I'd been in, sedation, that were not real. My room was vividly real, like more real than real had ever felt. And I remember seeing, there was a massive, there was all kinds of stuff that was taped to my walls in the room. So the window to outside is to my left. There's a TV on this wall, and the glass door to the right. Glass wall, glass door in the nursing station. So up in this left-hand corner of the room, there was a massive get well soon card from the hospital. So basically the ER staff, I think it was the ER staff, the overall staff. So all the different departments that I had associated with were there, had signed it. And there were cards up from people from church, from people in the community, people that I haven't spoken to in a long time. And it was so strange to come to in this environment, and just this outpouring of attention about something that you are just finding out about yourself. So that was so strange. All of these people are writing, get well, get better, telling me things and saying nice stuff. But all of this was taking place while I was somewhere else. I was completely out of it. So to come to and see that was overwhelming. It was so overwhelming. And maybe part of it was because of where I had come from. It was so night and day. The hallucinations that I had been experiencing, the fluctuations in being lucid and hallucinating, and trying to wrap my brain around, the incoherence of the hallucinations while trying to, maintain the understanding that they were just hallucinations because they were so real. So, when I'm talking, I keep saying, talking, but the reality is I wasn't talking. If I was on FaceTime with my partner, she was talking. I was listening. At best, the nurse might say something, in reference to something that I'm going through. If my partner asked a certain question about, what did you do today? The nurse might actually, be there in the background and say, what I was doing. But, this whole time, I can't tell her about all of this shit that took place prior to this moment. We're on the phone and I am, listening to all of the emotions come out of her, and not being able to respond. First, sucks. Second, to not be able to also communicate my experiences. It's almost like everything that I went through didn't take place because nobody's aware of it, because they knew I was agitated, but to them I was in a coma. So unless I'm telling them, no, there was a whole bunch of stuff that took place, they don't know. So I couldn't, because I couldn't speak, I couldn't communicate that. So every time my partner called, I'm not able to speak. And all I can do is listen and think like, oh my God, how am I supposed to tell her all of this stuff once I am able to speak? Because by then I will barely be responding to the things that she was saying when I couldn't speak. I'll just be catching up. So it just seemed like this cycle of I'm never going to get around to speaking, about all the things that I'd gone through. But it was a nice break, obviously, because when I was sedated, when I was put under, I had communicated to the staff that I would prefer, because they ask, what's your preference on what is on TV? And I told them that I don't want anything that is competitive. I would like relaxing gardening, relaxing cooking, like a cooking show, not a cooking competition. Like Emerald Lagasse or, something like that is good. But Hell's Kitchen? No, I don't want to watch Hell's Kitchen when I'm unconscious. Something gardening would be great, but like disaster gardening show competition? No, I don't want that, anxiety, I guess, in the background. So that's what I had told them when I was sedated, and then when I woke up, I remember, in addition to seeing all of these cards and all of the stuff that everybody had sent, I remember on TV there being a cooking competition. And it was super high energy, it was loud, it was, lots of noise just in general, and very, very not relaxing at all. And again, I could not communicate. So this was one of those things that affected me, like it bothered me, because I was being fed this anxiety that was unnatural, and I couldn't get it out of my environment because I couldn't speak to the nurse. I couldn't say, hey, could we change the channel? And I know that I'm kind of jumping around with some stuff, but this specific time was that transition between fully sedated and fully conscious, fully alert and oriented. So that transition was intense. Like it was weird. I now realize, I guess, that because I was on fentanyl, maybe I didn't really experience the withdrawal symptoms because I couldn't feel them. I don't know. But I remember the wean off process when I finally felt like I was out of it. I remember the first morning, the doctors coming around to do their rounds, and it kind of sank in that a lot of stuff had been taking place around me without my knowledge, because I hadn't really moved in all that time. I might have moved rooms, but I mean, I'm still spending 99.9% of my time in the ICU, if not 100% of my time. So, there's a cadence and a flow to life in a hospital, and one of those cadence points is doctor's rounds in the morning. So all of that time they had done this dance where they come around and they do the report and they update each other and they talk about test results and they ask for tests to be done and they look at progress, they look at all this stuff, and there's a team of people out there that are doing this, and your nurse. And I'm just seeing this happen for the first time as a patient, realizing this had taken place for 2 weeks without my knowledge. And that was kind of a weird thought, like all of these things that had taken place in my experience that didn't actually take place while this cadence of life was taking place around me, that I was completely oblivious to. So there was a lot of confusion, that I was experiencing. There was a lot of being unsettled, just in general, I guess. There was a significant amount of anxiety that was just persistent. But my day seemed to go by pretty quickly. Like there wasn't a lot of downtime, even though it probably seems like, being a patient in the ICU, or if you've been a patient in the ICU, maybe there was some downtime, but it seemed like I was up at rounds. They were getting me moved around. They'd get me situated for the day, and that meant doing whatever the last part of the night shift person's day needed to be, and then, the first part of the new nurse's rounds. So you kind of get that double whammy where one has to be finishing something and then one's got to be starting something. So usually you get hands-on at transition points. But then in between, I'm required to be turned every 2 hours. So to prevent pressure sores, you have to turn off of your skin, wherever the pressure is, you have to turn off of that. So hypothetically, start my day on my back flat. I can do that for 2 hours, at which point I need to be turned on my left side or my right side. When I would get turned, so I remember the first time that I was alert for it. They had to clean me up, and they came in. They turned me onto my left side, and I remember that I couldn't breathe. Suddenly it just felt like there was no, like my lungs were blocked, like there was a piece of food kind of, but it wasn't like that. It was just kind of like when I turned, or when I was turned onto my left side, everything just kind of closed off. I could not breathe, and my oxygen saturation would start to decline, and it actually astonished me how much oxygen saturation you can maintain while you can't breathe, because I remember feeling the panic of not being able to breathe before I would really see the icon on the screen go, you know, dip into a point that I thought was relative to my difficulty of breathing. And I hated being turned onto my left side. Turned me onto my right side, no problem. Left side, I could only do it for a short duration. And I found out that I had a mucus plug, I guess. So, you know, where your lungs branch, there was one side, I guess. I'm assuming, I don't know, to be honest. One side had a mucus ball or whatnot that was just. Now I was making a lot of mucus, and we're gonna, you know, start talking about the suctioning that I was experiencing and the percussion chest exercise that I had to do with the respiratory therapist several times a day, and, you know, other things. I'm gonna cut this video though. I think it's gonna be enough for today, but I'm gonna plan over the next, you know, short duration to get back to another video and continue talking about the next steps, and we'll go from there. But thank you again for your time, and if you're on Facebook or YouTube, and you guys have questions about things that I've spoken about already, feel free to comment. I don't know what the time frame will be for me to respond to comments and stuff, because I don't really go on to check a lot of that stuff. I'm trying to do this more for you. If there, again, any of my experience that can be helpful, especially as we get into, you know, the challenges of the insurance and navigating the hostilities of certain environments, and standing up for your own rights, and, you know, asking for the things that you're supposed to be receiving that they're just not giving you. You know, my goal again is just to share as much as I possibly can. So I will continue to elaborate, and if you again have questions, feel free to ask, and I'll try to get back to them. But also, if somebody else has an answer that works, you know, and has been through something that can answer a question that somebody asks, you know, that could be helpful too. So use it as a forum if there's somebody else that can answer a question that is helpful. So again, thank you, and see you guys soon.